give the invocation. Then as now, I think it is critical for us to recognize the diversity that is present here in this hall. Look around you. We are a cross-section of the world of public health that all of you as graduates will be called upon to serve. Invocations used to be a moment when we would call upon some deity to bless this gathering. But given the many cultures, nations, and traditions that are represented here, I think the real invocation should be one in which we commemorate our commitment to public health and our commitment to make the world a better place because of the actions that you will take to make it so. It is an honor for me to be here. It is an honor for me to extend my congratulations to you. And it is an honor to imagine the world that you are about to enter, a world that I know you're going to do your best to make better. Dean Freed, I proudly present to you the graduates of the Mailman School of Public Health, class of 2013.
Thank you, Dr. Fulilov, for that wonderful invocation and for your own great commitment to this amazing school. Good afternoon, and please be seated. It is my great honor and pleasure to welcome all present as we celebrate and send off the Mailman School of Public Health's class of 2013. Commencement Day is always such a wonderful day. It brings us together in a culminating celebration like no other. We celebrate your hard work, growth, and accomplishments, and the commencing of the next steps of your careers. We celebrate the instruction and guidance and caring and aspirations of our faculty for you. And we celebrate the love and support of family and friends that made this possible. What a great day. We also celebrate the Mailman School's wonderful friends, and I am honored today to be joined on the dais by several of them. First, it's my pleasure to recognize Mrs. Phyllis Mailman, President of the Joseph L. Mailman Foundation. Mrs. Mailman and her family, Jody Wolf and Joshua Mailman, have been incredible supporters of the Mailman School and its crucial mission. We are profoundly grateful to the Mailman family and deeply honored that the school bears Joseph Mailman's name. We are pleased, really pleased as well, to be joined on the dais by the outstanding chairman of our Board of Overseers, Professor John Rowe, and in the audience, several other distinguished members of our Board of Overseers. In addition, Thomas Campbell Jackson, president of our Alumni Association Board, and also a Board of Overseers member, joins us on the dais today to help us usher our graduates from students to new alumni. Our alumni are here and are such a great source of pride for the Mailman School. They're here marching with us to welcome the students to become alums. Our alums are literally changing the world, both through their own work and through their crucial support of the school, contributing to our vital research and practice and training the next generation of public health leaders. In just a short while, these alumni will welcome the class of 2013 into their distinguished ranks, and I have no doubt that today's graduates will help them change the world in the ways we need to happen. I also want to recognize Executive Vice President of the Columbia University Medical Center and Dean of the College of Physicians and Surgeons, Dr. Lee Goldman. as well as the really fabulous Mailman School deans, department chairs, and faculty who join us on the dais and in the audience. You have led our graduates here today. Finally, I am truly delighted to welcome today's honoree and commencement speaker, Dr. Thomas Farley, Commissioner of the New York City Department of Health and Mental Hygiene, and a true public health champion. And now, to our graduates. What an incredible journey it's been. While commencement day may mark the end of your journey as a student here at the Mailman School, it also signals, of course, the beginning of an even more exciting journey, the one you came here to go forward on, and that you will now travel as a Mailman School alumnus and emerging public health leader. As you well know, 2/3 of health is created by public health factors. That is, our behavior, our environment, social factors, and our work to prevent disease and preserve good health for all of us. For public health, the population and community is the patient, while our prevention science is used to protect and improve the health of both entire populations and of individual patients in a proactive way across our full lives. What does this mean to you, our graduates? Well, this means that you have a tremendous opportunity to save lives and improve lives by the thousands, if not millions, at a time. What a profound impact on the world you will have. Public health is at a watershed moment. Recent studies show that while life expectancies have increased dramatically throughout the world, we're living too much, a greater proportion of our longer lives in poor health. Of great concern here at home is that compared to other developed nations, Americans are at risk of living shorter lives in poorer health. It is clear that while we have made huge gains in many areas, public health needs to move front and center. It is needed more than ever, and we need more of it. We know that public health challenges have grown far more complex, and contrary to much public discourse, a better healthcare system and increased access to health insurance, while critical, cannot on their own turn the tide on these rising issues. Public health researchers and practitioners and a strengthened public health system are absolutely essential in accomplishing this. When you consider the huge impact that public health factors have on an individual's health and a population's health, when you consider the significant number of lives that public health touches with each intervention, it is clear just how much public health matters. The world needs you, graduates, more than ever. The world needs you to perform the interdisciplinary research and collaborative translation of discoveries into the innovations and multi-sectoral partnerships that will capture and improve health. And the world needs you to make the compelling case for the population-based interventions, for prevention, and for how to design our future health systems so that they create health. The world needs your knowledge, your leadership, your creativity and innovation, and your passion. Now, we need you, in the lingo of the 21st century, to go out and change the world. Today, we honor your accomplishments and celebrate your promise. We also recognize those who have supported you in this endeavor and helped you to succeed here at the Mailman School of Public Health, even if they didn't initially understand what public health was. Today, they watched you march into this auditorium as a student, and soon they will watch you walk out a public health professional ready to transform the world. So class of 2013, please rise, turn around, and give your families and friends that thunderous applause they deserve to just show just how much their support has meant to you. You also have, no doubt, received significant support from one another. Public health is such a highly collaborative field, and we work hard to maintain that environment at the Mailman School. Hopefully, your time here has shown you that while one person rowing a small boat, can conquer small waves, when all of us are working together to steer a ship, we can sail towards distant ports in far larger waves much more successfully. You've all worked together to get where you are today. You've shared in each other's joys and triumphs. I know you have supported one another through challenging times, and no doubt have pulled a few all-nighters together. So please take a moment to thank your shipmates and to wish them well. I urge you to stay close with one another, continue to develop your friendships, to learn from each other, and we will know it's a success if you're collaborating with each other in coming years from different parts of the world. That is how real change on the toughest challenges occurs. I also urge you to remain part of this great community throughout your career as an alum. We remain committed to fostering your career development in an ongoing way, to serving as your roots, and to having you inspire future generations of the students who will come after you. The class of 2013, you hold so much promise, and we cannot wait to see what you will accomplish. It is now my great pleasure to introduce Dr. Lee Goldman, Columbia University's Executive Vice President for Health and Biomedical Sciences and Dean of the Faculties of Medicine and Health Sciences. Dr. Goldman is an extraordinary leader in the world of academic medicine and an internationally recognized expert in health outcomes and cardiovascular disease research. He's also deeply committed to public health. In fact, he holds both an MD and an MPH, as well as faculty appointments in the College of Physicians and Surgeons and the Mailman School's Department of Epidemiology. He truly understands the need for co-leadership and synergies across medicine and public health in coming years to improve the public's health. Dr. Goldman has also been your friend. You may not have known it, but he's enabled the growth and strengthening of our campus, including the new Bard Hall gym, which all the deans collaborated on. So please welcome Dr. Lee Goldman.
Well, Dean Freed, Mrs. Mailman, Dr. Rowe, Commissioner Farley, distinguished faculty, graduates, family, and friends. It's really a pleasure to be here and to welcome you all to this spectacular event. As Dean Freed said, I'm a dual agent, holder of both an MD degree and a Master's of Public Health degree. And I have to say that from the time I began my MPH studies back when I was in medical school, it's always provided me with the kind of what I'll call population and moral compass that hopefully helps us all. As a physician, I spend my time trying to help one person individually, one at a time. But all of us in the health professions have a broader responsibility, a bigger calling. That's to help lots of people in ways that go well beyond what one person can do one-on-one. In public health, as in medicine, you and we do both. Programs where we interact with individuals and programs where we change populations. And I don't want to underestimate the challenges in front of us, whether we're thinking locally and nationally or even globally. But to put things in perspective, here in the US, we can argue, we can debate it, but we can certainly argue the point that we have the best acute medical care system in the world. No better place to get sick. That's sort of the Hobson's choice, if you will. A good place to be if you're sick is not the kind of place most people want to live in. You want to live in a place where health promotion, health prevention, public health keep you from getting sick. And all of us share that responsibility, a responsibility that I believe we're going to be able to meet because of people like you. This is our future, and you're part of that. So I congratulate all of you on your graduation from Columbia. Thank you for being such a wonderful part of the Columbia University Medical Center community, along with your colleagues in the schools of nursing, dentistry, and public health. Thank you for taking your studies so seriously, at least most of the time. And thank you for the great things you're going to do to make this world a better place. Congratulations to all of you.
Now I have the great privilege and honor to introduce to you this year's commencement speaker and recipient of the Dean's Distinguished Service Award in Public Health, Dr. Thomas A. Farley. Dr. Farley has been Commissioner of New York City's Department of Health and Mental Hygiene since 2009. He leads one of the world's oldest and largest public health agencies. As Commissioner, he oversees the department's $1.6 billion annual budget and more than 6,000 employees. But far more than simply overseeing the agency, Dr. Farley has built upon the transformational vision and leadership of Mayor Bloomberg and former Commissioner Thomas Frieden to continue to lead New York City's health into one focused on accomplishing health for all of us at the most optimal level. Dr. Farley holds medical and public health degrees from Tulane University and a BA from Haverford College. He began his public health career as an epidemic intelligence service officer with the Centers for Disease Control and Prevention, the CDC, and later served as a medical officer at the Louisiana Office of Public Health, where he oversaw successful efforts to increase childhood immunization and control tuberculosis, HIV, and sexually transmitted diseases. Following Hurricane Katrina, Dr. Farley worked extensively in New Orleans with the Centers for Disease Control team on a long-term plan for rebuilding the city's public health and healthcare infrastructure. Immediately prior to his appointment here in New York City as Commissioner, Dr. Farley was chair of the Department of Community Health Sciences at the Tulane University School of Public Health and Tropical Medicine. Over his career, he has produced a large body of scholarly work on key public health issues, including Legionnaire's disease, prevention of HIV, infant mortality, and obesity. He is also the author, with Rand Corporation senior scientist Deborah Cohen, of a very important book entitled Prescription for a Healthy Nation, published in 2005, and which I know a number of our students as well as our faculty have all read. This book lays out how changes in our environment can improve behaviors and thus health and counter the leading causes of chronic disease. Dr. Farley now implements his own prescription. As Commissioner of the New York City Department of Health and Mental Hygiene, he uses his office as an action platform for evidence-based solutions to both pressing and long-term health concerns. His numerous initiatives exemplify truly innovative thinking evidence-based decision-making, and leadership action to make New York the healthiest city. With 50% of the world's population now living in cities and 75% by 2050, the urban environment increasingly shapes what the whole world eats, drinks, the air we breathe, and the amount of exercise we get, among others. As such, cities can be thought of as an integral part of a health system that creates health. In recognizing the extent to which the urban environment shapes health, the Bloomberg administration, with Dr. Farley, has made public health a signature of New York City. In 2004, under Thomas Frieden's leadership, the administration created Take Care New York, a bold blueprint for improving the health of New Yorkers by focusing on the most important issues affecting health and employing evidence-based interventions to address them. Now, under Dr. Farley's leadership, Take Care has expanded to cover how neighborhood conditions such as access to healthy, affordable foods and safe housing can affect health. With Dr. Farley's vision, the city has made great strides in improving the health of New Yorkers. From 2001 to 2010, life expectancy at birth in New York City increased by 3 years in only 10, a far greater increase than was seen anywhere else in the United States. Across New York City, deaths from heart disease, cancer, and HIV/AIDS have decreased, many to record lows. These and many other remarkable health gains reflect the power of great public health leadership and a model for great public health leadership that we know this graduating class will continue to ensure happens. It is now my great pleasure to introduce Dr. Thomas Farley, and I would like, before calling him up, to say why. We are so grateful for the impact that the Bloomberg administration and Dr. Farley, with your leadership, have made in changing the public health narrative in New York City and in cities throughout the world. We are also, of course, very proud of the Mailman School's close and long-term partnership with the Department of Health and Mental Hygiene, and together doing our parts to advance urban health. To Dr. Farley, for being a leader in creating the science-based scholarship that informs great public health practice, and for leading its implementation to create health for this great city. For implementing innovative programming and policies to create conditions within which people can be healthy. For keeping and elevating public health as a centerpiece of the mayoral agenda and improving health outcomes for New Yorkers. And for making New York City a model for public health leadership for cities throughout the world. It is my really great pleasure to present our Dean's Distinguished Service Award to Public Health Champion and 2013 Commencement Speaker, Dr. Thomas Farley. I get to surprise you with an award. The award says, the Dean's Distinguished Service Award is presented to Thomas Farley, MD, MPH, Commissioner, New York City Department of Health and Mental Hygiene, for his visionary leadership and commitment to urban public health. Tom, thank you.
Thank you.
Put it back here.
Thank you. After that introduction, I sort of feel like I should just sit down because I'm on such a high point here that it's hard to follow that up. But you know, when Dean Fried asked me to speak here today, I'll have to say I agreed immediately. First, because I don't want to pass up the opportunity to talk to people right at the beginning of their public health careers. And second, because I couldn't pass up the opportunity to speak seriously while wearing a funny hat. No, seriously, public health is absolutely a wonderful field. It's a field in which we save lives by preventing people from getting sick in the first place, which is the way to do it. And when we save lives, we save them millions at a time. But to the graduates today and to their parents, let me let you in on a little bit of a secret if you haven't heard it yet, and that is, if you want to be rich, you've gone to the wrong graduate school. But, if you want to feel good about what you do every day, that you feel like you're part of the solution, that you're paid to make the world a better place, you've absolutely made the right choice. So I want to talk and take this opportunity to talk about an idea that I've been thinking about recently, which I think is going to be important through the course of your career. So give me a minute to work my way into it. Public health as a field is changing, and it's changing rapidly. Our field grew up really in the era of epidemic infectious diseases, during times when there was public panic over epidemics from cholera and dysentery and yellow fever and smallpox and tuberculosis. And it took some time, but ultimately government...
We'll call Amanda Koo, an officer in our Student Government Association who has participated in various student leadership capacities at the school. Amanda.
The 2013 Mailman School Teaching Excellence Award is presented to Dr. Robert Fulilov. Dr. Bob, as his students affectionately call him, is one of the true giants at the Mailman School. One student describes him as an incredible gem of a professor. His insights and oratory skills are unparalleled. It is a true joy taking a class with him and having him expand one's mind. He is any course's greatest asset. Another recalls his ability to lead stimulating classroom discussions in this way. Dr. Fulilov was able to critically engage the classroom and create real dialogue and debate over current issues of health and race. He was able to effectively answer questions and get across the thesis of the course. Other students praised his enthusiasm, charisma, and commitment to furthering his students' knowledge. Dr. Bob, one student writes, is a smart, knowledgeable man who is a pleasure to listen to. Another sums it up simply, Dr. Bob is the best. For his warm engagement, his enthusiastic leadership, and his critical mentoring, we present the Mailman School Teaching Excellence Award to Dr. Robert Fulilov. The 2013 Mailman School Junior Faculty Teaching Award is presented to Dr. Marina Catalozzi. Again and again, Dr. Catalozzi's students extol her clear instruction, her dedication to learning, and her commitment to excellence in the classroom. As one student explains, Professor Catalozzi is a fabulous instructor. She is engaging, adaptable, warm, incredibly professional, and knowledgeable. Others describe her amazing willingness to take time to explain content as clearly as possible and answer any questions. Another student adds, I appreciated how much she tried to connect the content to our professional goals as public health practitioners. As one student sums up, Dr. Catalozzi is very committed to student development. She met with students on a regular basis and provided thoughtful written feedback for every assignment. It was outstanding. I strive to be a teacher like her. For her extraordinary contributions to learning, we proudly recognize Dr. Marina Catalozzi with the Mailman School Junior Faculty Teaching Award.
Thank you, Amanda. The student commencement speech given on behalf of the graduating class will be presented by Douglas Phillips, a Master of Public Health candidate within our Population and Family Health program. Douglas.
Good afternoon. I'd first like to thank our distinguished commencement speaker, Dr. Thomas Farley, for taking the time to celebrate this occasion with us. Dr. Farley's work as the New York City Health Commissioner has helped New York become a global leader in public health initiatives and one of the healthiest major cities in the world. I would also like to thank Dean Delva and Dean Freed for all that they do to ensure we students get the most out of our experience at Mailman. I had the opportunity to speak with Dean Freed at an event a few weeks back, and her genuine enthusiasm for helping students is palpable. When I tell people that I study public health, the most common reaction is, at best, one of vague understanding, which I completely understand. We are involved in a wide variety of things, and we wear many different hats. But exactly who are we as public health practitioners, and what do we do? With that in mind, I'd like to take this opportunity to describe a bit more about who we are and what we do. First and foremost, we are looking for jobs. We are scientists. We are researchers. We are nurses and doctors, social workers, teachers, policymakers, community health workers, and advocates. We measure success not in material possessions or notoriety, but in ratios and rates. We measure it in years of life increased and reduced costs for care. We are stubborn. Stubborn in the sense that we refuse to accept injustice and inequality as inevitabilities, but rather view them as problems to be solved. We believe that human rights are more than just a talking point. They are a fundamental part of life bestowed upon all people, and with no other criteria than the fact that they exist. We believe that health policies should be decided based on scientific evidence, and not on the whims of wealthy politicians who cringe at the mention of human anatomy. Parenthetically, this brings me to another point of concern. Our community is a little more comfortable with public discussions about human sexuality than the general public. Hello? Wonderful. All right. This was brought to my attention when an embarrassed Applebee's employee informed me that my booth discussion of various family planning methods was not appropriate dinner conversation. I would suggest that the lack of such discussions is inappropriate. We understand the immense power of words, that the difference between living with and suffering from can be the difference between access and outcast. We do not pity, rather we engage and we empower. We are mostly women. And not just any women. Public health workers include some of the most intelligent, capable, and opinionated women you're likely to meet. Simply put, these are the type of women you hope your daughters will grow up to be. This is not, however, to diminish the dedication of the men who work in public health. Indeed, the families of today's male graduates should be incredibly proud to have raised such remarkable men, all 18 of them. We are dynamic. If something doesn't go according to plan, we don't panic. We learn, we adapt, and we aren't afraid to get creative. And this, I think, may be our most valuable attribute. When things get tough, we don't throw in the towel. We don't quit. Oh, and vaccines, clean water, regulations on workplace safety, food safety, toxic pesticides, smoking and lead paint, affordable health care, and free access to contraception. That was us too. I'm proud of who we are, and I'm proud of what we do. Personally, I have never been more proud than I am today, with the knowledge that I can consider myself part of such a remarkable group of people. On behalf of the graduating class, we would like to thank all of the professors at Mailman for their generous support and sincere commitment to training the future leaders in public health. On a personal note, I would like to thank my academic advisor, Dr. Les Roberts, for encouraging me to act on my principles, and Dr. Linda Cushman, who has taught me a great deal about survey design and even more about personal integrity. I would like to thank my parents for their unwavering support and commitment to helping others for no other reason than it being the right thing to do. And I would like to extend my final thank you to my fellow graduates. Thank you for teaching me, thank you for tolerating me, and thank you for always pushing me to try to do better. Enjoy this day and this moment, because it's just the beginning of something great. Congratulations.
Earlier today, we held a student awards ceremony in reception and recognition of excellence in scholarship and service. I would like to call your attention to the list of outstanding students who received this award, which is located in your program. Congratulations to the awardees. Now, graduates, this is your moment. Vice Dean Begg and I will present the master's and doctoral candidates for graduation. To assist with the presentation, we have asked Lillian Morales and Charles Liriano from the Office of Student Affairs to join us. We will begin with our presentation of the doctoral candidates. Dr. Begg.
The School of Public Health collaborates with the Graduate School of Arts and Sciences to offer the PhD degree in the fields of biostatistics, environmental health sciences, epidemiology, and socio-medical sciences. These graduates participate in a convocation ceremony in the graduate school, but we are pleased that several of them have been able to join us here today. They are important members of our school, and we honor their achievements. The chairs of the departments that offer doctoral degrees will hood their candidates for the degrees of Doctor of Public Health and Doctor of Philosophy as I call out each candidate's name. We will begin with biostatistics. Dean Freed, I will now present to you the candidates for the degree of Doctor of Public Health in the Department of Biostatistics and the degree of Doctor of Philosophy in Biostatistics. Bingji Zhang. Now, for environmental health sciences. Dean Freed, I will now present to you candidates for the degree of Doctor of Public Health in the Department of Environmental Health Sciences. Kathleen Crowley. Anne-Marie Reardon. And now, the Department of Epidemiology. Dean Freed, I will now present the candidates for the degree of Doctor of Public Health in the Department of Epidemiology. George Friedman Jimenez. Dean Freed, I will now present the candidates for the degree of Doctor of Philosophy in Epidemiology. Etty Lipner. Bianca Malcolm. Magdalena Pachkowski. Lynn Meredith Petukova. Now for the Department of Socio-Medical Sciences. Dean Freed, I will now present candidates for the degree of Doctor of Public Health in Socio-Medical Sciences. Stephanie Cook. We've never decapitated anyone. Sarah Jossel. Dean Freed, I will now present the candidates for the degree of Doctor of Philosophy in Socio-Medical Sciences. Abigail Edgecliffe Johnson. Claire Ellen Eddington. Nora Jane Kenworthy. Sahar Sajadi. Now we present candidates for the master's degree. Dean Freed, I am privileged to present to you candidates for the degree of Master of Science. Judah Aberbach. Aliza Balden. Guy Cole. Drew Dano. Maria Ham de Miguel. Alexandra Nicole Dedrick. Stacy Diner. Ellen G. Denton. Guqian Du. Rebecca Gross. Kathleen Heslin. Sunfang Shui. Catherine Huang. Chunxiao Huang. Foiruz Kabir. John Klein. Yiqian Li. Emerson Lim. Shui Jing Lin. Xiaoyan Liu. Yi Liu. Siripan Napita. Ian Willett. Harivuni Rakatu Aravello. Nicholas Rouse. Lin Tao. Chen Chen Yu. Wenjing Zhao.
Dean Freed, I am pleased to present the candidates for the Master of Public Health degree. Gabrielle Abuzalman. Rachel Abrahams. Ashley Ackerman. Chukwanyere Agoto. Faiz Ahmad Khan. Sarah Akyar. Lauren Elizabeth Alexander. Christopher Allen. Saman Alvi. Ami Amin. Colleen Andrews. Anyikachi Anukam. Linda Arnadi. Joseph Arnvatsky. Nidha Aurora. Mario Arredondo. Eric Asumante. Mohammed Aliafi. Islamia Babs Animashan. Kashro Begi. Jacob Ballin. Deborah Bamel. Nicole Bannister. Rohima Begum. Lauren Bellhouse. Sarah Burke. Seema Bandari. Raghilder Bernadatir. Jacqueline Blackman Forche. Nana Kunama Boateng. Jasmina Bogdanovich. Heidi Bonilla. Dustin Boone. Sylvia Bulos. Allison Boyle. Sarah Bressler. Christina Brown. Ava Bazovich. Hameen Shamdawala. Yvonne Chang. Dalia Shayabed Makadam. Richard Chewin. Rebecca Chen. Natasha Chiofalo. Jennifer Chu. Catherine Chung. Dana Crisfield. Andrew Twas. Betty Chung. Christine Chung. Morgan Sira. Jacqueline Claney. Heather Cobb. Bergen Cooper. Ashley Yvonne Creaky. Kristen Cribbs. Julia Cuthbertson. Sufi Daniel. Mallory Davis. Natalie Daw. Erin Delker. Joshua Dem. Whitney Decio. Miranda Detman. Caitlin Devaney. Jonathan Dia. Casey DeCoco. Michelle Dixon. Ella Douglas Durham. Donna Dowie. Russell Dowling. Lindsay Dubois. Jared Dunlap. Nathalie Dugavage. Nimaako Cece McKinney Brown. Meredith Eddy. Max Ehrman. Judith Eichner. Mercedes Icono. Sarah Elazon. Nicolia Eldred Scamp. Barbara Elia. Amy Elitzer. Tala El Youssef. Amanda Fales. Mariam Leila Famori. Maggie Farhat. Serena Fasano. Melinda Fang. Brianna Ferrigno. Melanie Firestone. Avital Friedman. Irena Froelich. Benjamin Fu. Melissa Garber. Edward Gastel. Lindsay Gay. Anna Gasinski. Valerie Gabara. Noam Gerber. Noreen Giga. Samantha Gilman. Sarah Ann Givner. Danielle Golden. Camille Cassandra Gonzalez. Lori Grant. Jasmine Graves. Justin Graves. Mara Gorbeck. Gogi Graywall. Allison Gruber. Whitney Gruen. Carolyn Hellick. Allison Hamburg. Emily Hamilton. Victoria Hamsho. Summer Hamza. Lamia Khan Hawk. Yukari Hara. Lauren Hartstein. Lorlette Hutton. Tamri Hadani. Natalia Heredia. Leah Hoffheimer. Angela Margaret Haluba. Rebecca Shea. Jessica Wang. Tanner Wang. Su Young Wang. Adetola Ilegbosi. Paul Ippolito. Kelly Jamison. Caroline Janig. Leah Jarvis. Tanya Gentil. Jeremiah Johnson. Red Jew. Sarah Jabinski. Catherine Caleris. Arinda Kalimi. Muniza Kalhan Siddiqui. Anushka Konyapur. Danielle Katz. Tanya Kaufman. Ali Khan. Barry Kilcoyne. Catherine King. Grace Keyabu. Anna Klikova. Joanne Kong. Caroline Kornhusser. Noemi Kornhusser. Sejal Kafari. Tarush Katari. Stacy Kramer. Leslie Kwan. Kelly Kwan. Fabienne Kyle. Peter Lamb. Clara Lapinier. Layla Larson. Caitlin LaRussa. Colin Lullen. Annie Lee. Sung A. Jenny Lee. Stella Lee. Eric Lee. Erica Lee. Joan Jiha Lee. Garrett Lee Strizich. Shauna K. Lester. Amanda Koo. Amelia Hallstrom. Erica Levine. Sharon Levine. Shannon Levine. Alana Leviton. Katie Lewis. Carrie Lee. Beatrice Lynn. Janine Lynn. Frances Lincoln. Mindy Lipson. Jordan Light. Tina Liu. Rebecca Lowe. Rebecca Logan. Dominique Lowe. Abigail Lowen. Jenny Lau. Jenny Liu. Stephanie Lum. Benjamin Moss. Matthew McFarland. Jennifer Dorley Magaziner. Lydia Mylander. Renata Maniaci. Cole Manship. Mustafa Manzoor. Mariana Marcus. Andrea Marquez. Michelle Martin. Haley Martinez. Torianne Mason. Jonathan McAteer. Denise McCormick. Samuel McCrimmons. Martin F. Mendiola. Leslie Meng. Jeanette Merrill. Jesse Michaluk. Sean Michaels. Julianne Minching. Anissa Mohammed Ismail. William Moyer. Monique Bonita. Claudia Montes. Simon Morgan. Michelle Morris. Amanda Moy. Jeetman McKergy. Jeanette Mooney. Ivory Mushamiri. Sharifa Nelson. Ariella Newman. Sanal Nissam. Alexander Niazov. Michelle Nolan. Sylvia Niyamu. Badunde Onemola. Anna Oprescu. Anna Oru. Sabine Oscar. Anita O. Debbie Padilla. Hewlin Pan. Aliyah Papayan. Monica Parisi. Corin Parella. Anjali Patel. Mendogus Punantis. Sarah Pellegrim. Christopher Perry Kuhn. Eleni Petro. Okay. Christopher Filippo. So I got mango. Douglas Phillips. Carla Purini. Jonathan Platt. Catherine Poland. Esther Pomares. Andrea Popovich. Heidi Poppendek. Ariel Port. Carissa Pratt. Prachi Priyam. Angeline Potasio. Ying Chi. Rebecca Rabinowitz. Malika Raghavan. Julie Rahill. Marlene Nava Ramos. Christine Raper. Rebecca Rappaport. Marika Rasmussen. Mariam Rita. Sunitha Reddy. Jennifer Reed. Emily Riley. Natalie Rhodes. Holly Riley. Jenny Robbins. Caitlin Robinson Ector. Eva Rodriguez. Christine Shu Brody. Christina Rosales Kostrakova. Angana Roy. Leela Rungtragol. Vera Rungtragol. Alvin Rucker. Jamie Ryan. Paige Ryland. Hasina Sahib. Nazia Salam. Aliyah Sanders. Shohini Surma. Divya Sachapriya. Rohini Saxena. Sarah Shell. Maya Scherer. Amy Schlegel. Tiffany Schreidel. Ashley Schuyler. Suzanne Schwechter. Stephanie Seat. Melissa Shaw. Sana Shakir. Abigail Sherkaw. Gordon Schott. Juliana Silva. Rachel Simhan. Iman Simmons. Nidhi Singh. Molly Skinner Day. Rachel Catherine Slyman. Susanna Slocum. Elizabeth Spangler. Patu Sipanlap. Alice Stead. Leilani Stefan. Joanna Stein. Adam Stoller. Marissa Strasburger. Sarah Suleiman. Lucy Sun. Hannah Syed. Nilofer Tabor. Alisa Hafner Tartaglione. Nina Tarbesi. Ashley Tai. Paul Bradley Thaler. Toby Amanda Tobin. Tenzin Sayang. James Turnbull. Keen Sung. Zoe Unger. Shayla Vadia. Nari Vadrasasan. Anna Vaslayeva. Shauna Vine. Arthi Verkud. Peter Vizone. Jan Samuel Wagner. Chen Wang. Xiao Liang Wang. Sarah Wee. Lauren Weisenflu. Kristen White. Elizabeth White. Jesse Whitfield. Nina Wilberforce. Caitlin Wolf. Yi Shu. Stephanie Ravoto Yegos. Shweja Young. Christina Young. Anna Yu. Kathleen Yu. Yu. Jennifer Zakaras. Neda Zaidan. Alanud Kathela. That's it? Last but not least, Coral Zelon. Congratulations, graduates. We will now hear a few words from the president of our Alumni Association, Thomas Campbell Jackson.
Fellow alumni, it's my privilege to welcome you as the newest members of the Mailman School's Alumni Association. You joined some 10,000 other graduates already using the knowledge, the skills, the connections they gained here at Mailman to improve human health across the globe and around the country. Your Alumni Association is here to help you sustain the academic, the professional, and the social connections you've made at your time at the school. We welcome anyone interested in participating in our committee work or even joining the board itself. On Thursday, June the 13th, we'll hold our 5th annual Alumni Summit for Public Health Leadership. At the Italian Academy on the Morningside campus, we'll have a panel discussion on mass incarceration. We'll have a networking reception, a dinner, and presentation of the Alan Rosenfield Alumni Award for Excellence. This is all free of charge to the graduating class of 2013. The Alumni Association sustains the Fund for Public Health Leadership, providing financial aid for your fellow Mailman students. I encourage you all to kick in a few dollars each year to help the students who come after you. And by all means, join the thousands of other Mailman alums on Facebook, LinkedIn, Twitter, and the other networking platforms. But there's more. As a graduate of the Mailman School, you're now lifelong members of the Columbia Alumni Association. The CAA brings together all the schools of the university, and this is a network some 300,000 people strong, ready to provide you with connections and collegiality. Wherever you're headed next, you won't be far from one of the CAA's 90 clubs and associations around the world, from the Alumni Arts League, which has just given you a free year's membership, to networking nights on and off campus. The CAA is a valuable resource. So in short, remember that you and Mailman have made significant investments in one another. Mailman remains your school, Columbia, your university. Stay connected for the sake of your career and the students who follow you. Help alma mater help you to change the world. I hope to see you at an alumni event sometime soon. Thank you and congratulations.
Well, congratulations to all our graduates. Before we conclude our ceremony, it is the tradition of the Columbia University Mailman School of Public Health graduates to affirm our commitment as public health professionals by saying together the public health oath found in the last pages of your program. The oath is but one of many innovations of the Mailman School in its 90 years of history. It was developed here by a group of Mailman School faculty members and students across the school and was created to articulate the ideals and professional commitments that all of us in public health hold dear and subscribe to. Today, just as the first day when you joined us as incoming students, today is the ideal and important opportunity for us to join and read together what has become a critical part of our public health commencement ceremony and your professional commitment as you now transition from students to alumni and public health professionals. So to our graduates, to our faculty and alumni, I ask that you please stand and join me in reading the public health oath. Health is a human right. The public health community exists to safeguard that right. I believe it is a defining element of a civil society. Public health represents the collective actions necessary to protect the health of all people. Through prevention, science, and practice, we can accomplish this goal. As a public health professional, guided by these principles, I declare the following. I will work to ensure that people have the chance to live full and productive lives, free from avoidable disease and disability, and supported in their pursuit of physical, mental, and social well-being. I will hold myself to the highest ethics, standards, values, and responsibilities as I move forward the science and practice of public health. I will respect the rights, values, beliefs, and cultures of those individuals and communities with whom I work. I will rely on evidence to support my decisions and actions and translate that evidence into policies and programs that improve health for all. I will add to the body of research and knowledge and share my discoveries freely. I will continuously seek new information and be open to ideas that can better protect and promote the health of populations. And I will advance health literacy for all and seek equity and justice for vulnerable populations. With this oath, I commit to the ideals and mission of public health. Please be seated. This marks the conclusion of this year's commencement ceremony. I hope you all will join us in celebrating the achievements of these amazing graduates and the completion of a really exciting academic year at a reception to be held on this floor of the Armory just beyond the edge of our ceremony area, as well as on the first and second floors of the Armory. We ask that all guests remain seated until our faculty and graduates have recessed. Graduates, please remain where you are until you're directed by the ushers to recess after the faculty. And congratulations.